Cardiac and non-cardiac chest pain. Main causes. When trying to distinguish between cardiac and non-cardiac chest pain, a person needs to consider the following three factors: the location of the pain, how the pain feels, the accompanying symptoms. We discuss each of these in more detail. Location of chest pain. Both cardiac and non-cardiac chest pain can occur in the center of the chest behind the breastbone. However, cardiac chest pain can spread across the chest and even affect other parts of the body such as the arms, back, shoulders, neck or throat, jaw, teeth. Non-cardiac chest pain such as heartburn tends to remain localized, meaning that it does not spread to other areas. Heartburn typically develops behind or underneath the breastbone. How the pain feels. Some of the words that people use to describe cardiac chest pain are pressure, squeezing, heaviness, fullness, tightening, aching, burning. In contrast, non-cardiac chest pain tends to feel like an intense stabbing or burning sensation just beneath the surface of the skin. Coughing, breathing, or moving can affect the intensity of non-cardiac chest pain, while the severity of cardiac chest pain usually remains stable even when resting. Accompanying symptoms. The symptoms accompanying chest pain can be an important indication of whether it is a cardiac or non-cardiac. The symptoms that can occur along with cardiac chest pain may include shortness of breath, irregular heartbeat, dizziness or lightheadedness, numbness, pain or discomfort in other parts of the body such as the arms, neck, jaw, shoulders and back. Symptoms that indicate that the chest pain is from heartburn or GERD can include pain or difficulty swallowing, bloating, belching or hiccups, bad breath, a sore or irritated throat, an unpleasant or sore taste in the mouth. Other causes of cardiac chest pain. Causes of cardiac chest pain can include angina, coronary artery disease or CAD, also called ischemic heart disease or coronary heart disease. Occurs when fatty deposits build up in the arteries that supply blood to the heart muscle. Over time, these deposits can restrict blood flow, which can cause a type of chest pain called angina. Coronary artery disease can also lead to heart attacks and heart failure. People often describe angina as a feeling of pressure, squeezing, burning, or tightness behind the breastbone. This pain can spread to other parts of the body, including the arms, jaw, neck, and shoulders. Angina often occurs during physical activity, and stress can also bring it on. If the pain continues after rest, this can be a sign of heart attack. People who are unsure whether they are experiencing angina or a heart attack should call for emergency services immediately or go to the hospital. Myocarditis. Myocarditis is a rare form of cardiovascular disease that causes inflammation of the heart muscle. This inflammation can lead to chest pain, heart failure, or sudden death. According to the National Organization for Rare Disorders, myocarditis commonly develops without an identifiable cause. However, doctors often diagnose people with myocarditis following a viral or bacterial infection. Myocarditis produces symptoms similar to those of other heart conditions such as chest tightness and fatigue. Leaning forward can help relieve chest pain resulting from myocarditis. Other symptoms of myocarditis include slow heart rate, irregular heartbeat, dizziness or lightheadedness, loss of consciousness. Hypertrophic cardiomyopathy. Hypertrophic cardiomyopathy or HCM is a thickening of the muscle wall in the heart. People can inherit genes from their parents that increase their risk of developing hypertrophic cardiomyopathy. However, hypertrophic cardiomyopathy can also occur as a result of high blood pressure, diabetes, or thyroid disease. The symptoms of hypertrophic cardiomyopathy include chest pain that often results from exercise, shortness of breath, fainting, fluttering heartbeat, or heart palpitations. Pulmonary hypertension. Pulmonary hypertension refers to high blood pressure in the arteries that supply the lungs. Common symptoms include shortness of breath and chest pain, which may occur or worsen with physical activity. Over time, symptoms may become more frequent as the disease progresses. People with pulmonary hypertension may also experience fatigue and weakness, fainting, lightheadedness or dizziness, irregular heartbeat, a dry cough that may bring up blood, swelling of the legs or feet that results from fluid buildup. Other causes of non-cardiac chest pain. Causes of non-cardiac chest pain can include pneumonia. Pneumonia is a chest infection that causes the tiny air sacs inside the lungs to become inflamed and fill with fluid. A common symptom of pneumonia is chest pain that typically worsens when a person inhales deeply or coughs. The chest pain can range from mild to severe. Other symptoms of pneumonia can include difficulty breathing, shortness of breath, coughing that produces green or bloody mucus, fever, chills, fatigue, loss of appetite. Peptic ulcer. A peptic ulcer is an open sore in the lining of the stomach or small intestine. Bacterial infections and long-term use of non-steroidal anti-inflammatory drugs can lead to peptic ulcers. Peptic ulcers can cause a painful burning sensation that starts in the abdomen and extends to the chest. This pain can come and go and may get better when a person eats or takes an antacid. Other symptoms of peptic ulcers can include bloating, belching, nausea and vomiting, dark stools, unexplained weight loss, loss of appetite, lightheadedness. However, not everyone with peptic ulcers experiences symptoms. Costochondritis. Costochondritis is an inflammation of the cartilage around the breastbone. This inflammation can cause tenderness and sharp chest pain that may feel similar to the pain of a heart attack. The pain from costochondritis usually affects the left side of the chest, but it can sometimes affect both sides. Deep breathing, coughing, and physical activity may make the pain worse. Possible causes of costochondritis include severe coughing, chest injuries, infections, and overexertion. Esophageal spasms. Involuntary spasms or contractions of the food pipe can cause intense chest pain. These spasms can come on suddenly and sometimes last for several hours. Other symptoms of esophageal spasms may include intense pain or tightness in the chest, feeling as though something has become stuck in the throat, stomach contents coming up the food pipe, difficulty swallowing. It is not always clear why esophageal spasms occur, but risk factors include GERD, anxiety, and high blood pressure. Panic attack. A panic attack refers to a sudden attack of intense anxiety and fear. These attacks can last for between a few minutes and several hours, and a person may feel as though they are having a heart attack. Symptoms of a panic attack can include chest pain, pounding, rapid or irregular heartbeat, trembling or shaking, shortness of breath, a sensation of choking or suffocating, nausea, dizziness or lightheadedness, numbness, sweating, feelings of doom, loss of control or unreality. A person may have a panic attack in response to a stressful event, but an attack can also occur unexpectedly. Recurrent panic attacks are a symptom of panic disorder.